If you're here today, it's probably because you or someone you care about who is over 50 is wondering which medical tests are truly worthwhile and which ones might create more problems than solutions. That's exactly what I want to help you understand today. My name is Dr. Gabriel Mena, and after many years caring for people of all ages, I've learned that good medicine is not about doing more, but about choosing what genuinely protects your health and helps you avoid unnecessary risks. Throughout my medical career, I have cared for thousands of patients. I've witnessed recoveries that felt miraculous, and I've also accompanied families through very difficult moments. Those years listening, observing, and learning taught me something that is rarely spoken openly. Many times, the wisest choice is to avoid certain tests that may sound modern or preventive, but that can end up harming your quality of life, especially after age 50. Today, I want to open this conversation with complete honesty. I want to explain which routine medical tests, in my experience and based on solid evidence, I would not recommend for most people over 50. Not out of stubbornness, but because I've seen how seemingly harmless tests can trigger a chain of invasive procedures, unnecessary worry, and complications that never should have happened. At this stage of life, what matters most is protecting your peace of mind, your independence, and your daily well-being. So if you've already passed the age of 50, or if you take care of your parents or grandparents, I invite you to listen calmly. I won't just tell you what exams to avoid, I'll explain why, and I'll offer safer and more useful alternatives. I'll also share real experiences from my patients, stories that leave valuable lessons, always supported by clear data. I'm Dr. Gabriel Mena, and I welcome you to my channel. Here we talk about whole body health, longevity, and simple natural habits that help you maintain physical, mental, and emotional balance. Take notes and share this with your family and friends so they can improve their health as well. We upload new videos every single day, so make sure to subscribe and turn on notifications so you don't miss anything. Before we continue, if you find this information helpful, supporting the video or sharing it is a simple way to help others who need this message. Thank you truly for being here and for taking care of your health. Now, let's get into the topic. I want you to know that this isn't about generating fear. This is about giving you clarity. When you understand what you're doing and why you're doing it, you make wiser decisions for your health. Let's start with the first exam on the list, the so-called full body scan. You may have seen it advertised as a complete look inside your body using advanced CT or MRI machines. It sounds appealing, I know. The idea of seeing everything happening inside your body seems reassuring, but the reality is usually very different. Let me tell you about a case I had not long ago. Ricardo, 74 years old, active, someone who enjoyed traveling and spending time with his grandchildren. He felt perfectly well. His son, wanting to take good care of him, gifted him an executive checkup that included a full body scan. Ricardo agreed, just to please him. But from that moment on, he began a chain of events no one expected. The report mentioned a small, indeterminate lesion on his kidney. Two simple words completely disrupted the family's peace of mind. Although Ricardo was perfectly healthy, he suddenly became a patient with something on his kidney. Following standard protocols, he was referred to a urologist who recommended a biopsy. And a kidney biopsy is not minor. It carries risks such as bleeding, infection, and pain. He went through the procedure with courage, but the week waiting for the result felt endless for his family. And what did the biopsy show? An angiomyolipoma, a benign growth that would never have caused any problem. Ricardo gained nothing from that scan. What he did receive was anxiety, an invasive procedure, and unnecessary fear for everyone involved. Sadly, this type of story is extremely common. Most older adults who undergo these scans end up with irrelevant findings, what we call incidentalomas, harmless cysts, tiny spots, small age-related changes inside the body. Things that require no treatment at all, but once discovered, can trigger a cascade of tests and interventions that may cause real harm. And if the scan is done with CT, there's another factor, radiation exposure equivalent to hundreds of chest X-rays. While a single test carries a low risk, that risk isn't zero. And if there's no clear benefit, why expose yourself? So what's the better option? Instead of relying on machines, a much smarter alternative is a comprehensive geriatric assessment. It's an in-depth evaluation focused on how you are truly aging. We assess frailty, medications, lifestyle habits, and physical function. Simple things like walking speed or grip strength predict your future health far better than any image. This type of assessment creates clarity, not fear. And it allows us to make adjustments that truly improve daily quality of life. I remember a patient, Leonore, 71 years old, who came in exhausted and convinced she had a serious illness. When I reviewed her medications, I discovered she was taking 11 different pills prescribed by several specialists. We adjusted her treatment, and within 2 weeks she felt like a completely different person. More energy, better mood, fewer dizzy spells. Sometimes what changes your life isn't a scan, it's understanding what your body actually needs. But let's continue. The second test I usually avoid is a brain MRI performed only because of small, normal age-related lapses. It happens often. Worried children bring in their 75-year-old mother because she forgot the name of an actor. But she stays oriented, manages her finances, and lives independently. Even so, they request an MRI just in case. I want you to understand this clearly. In cases like these, an MRI almost never brings any benefit. What it usually brings is unnecessary fear. I'll share an example. Marta, a highly educated woman, sometimes struggled to recall the perfect word. Her daughter insisted on getting an MRI, and when they read the report, they were terrified. It mentioned mild atrophy and changes consistent with aging, completely normal at 78 years old. But they interpreted this as the beginning of a serious disease. Marta became so anxious that she stopped doing activities she loved. The test didn't help her, it hurt her. Before we move on, I want to invite you to subscribe to the channel, share this video, and turn on notifications. Every day we post information that can help you or someone close to you. We are a community looking for clarity and well-being, and I would be glad to have you here. When we talk about tests that may cause more harm than help after age 50, one of the most sensitive is the brain MRI for mild forgetfulness. This worries many people, and that's why I want to help you understand clearly what to expect and how to make the best decision. What many people don't realize is that in adults over 75 who don't have serious symptoms, the vast majority of brain MRIs show something abnormal. Large studies have shown that if you take 100 healthy adults of this age, almost all will show a finding that can be alarming. Not because they are sick, but because normal aging leaves marks that the machine detects, marks that have little to do with memory or daily function. In my experience, I've seen patients whose MRIs looked like their brains were heavily damaged, yet they maintained remarkable clarity and mental ability. And I've seen the opposite as well. The image doesn't always reflect what the person is capable of doing. Most importantly, these findings rarely change how we manage mild forgetfulness. There is no medication that reverses normal age-related changes in the brain. So, what can we do to assess memory in a more useful, human, and reassuring way? The most reliable tool is a simple cognitive test done right in the clinic that takes just a few minutes. It could be the Mini-Cog Mini Mental State Exam or MoCA. These tests are simple exercises, like repeating a few words or drawing a clock, but they give us highly accurate information about how your mind is functioning in daily life. If the result is normal, both you and your family can be reassured. And if it shows some difficulty, we begin an organized search for causes that can be corrected. I call this approach the house of false culprits, because before considering a neurodegenerative disease, we need to rule out very common issues that cause forgetfulness but improve significantly with treatment. The first step is reviewing medications. Many older adults take sleeping pills, anti-anxiety drugs, or certain antihistamines that cloud memory and concentration. More than once I've seen patients improve simply by adjusting these medications. Next, we order basic lab tests. We check vitamin B12 and thyroid function because a B12 deficiency or hypothyroidism can cause memory problems that are easily mistaken for more serious conditions, but that are treatable. We also assess mood. Depression in older adults often presents as forgetfulness or disinterest, and treating it restores mental clarity. And we cannot forget sleep. Sleep apnea, which interrupts breathing at night, can significantly impact memory and daily performance. Only after ruling out these causes, And if we see cognitive function continuing to decline, do we consider imaging? In that context, it can be useful. But ordering it too early only increases anxiety without providing helpful answers. That's why I always recommend seeing a doctor willing to talk calmly, evaluate your real function, and investigate causes that can be modified. I want to share a recent experience with Mrs. Pilar, 76 years old. She came in worried because she kept repeating questions. When I reviewed her treatment, I noticed she was taking 2 sedatives prescribed by different doctors. We adjusted her medications, and within a few weeks she felt clear and confident again. She didn't need an MRI, she just needed someone to see the full picture. Now, let's move on to the third test to avoid: routine cardiac stress tests in adults over 50 who have no symptoms. Putting a person who feels well on a treadmill just because of age is very common but can cause problems. Let me share a case similar to what I see frequently. Javier, 72, exercised daily and had never experienced chest pain or shortness of breath. He was preparing for hernia surgery, and as part of the protocol, they asked him to do a stress test. He didn't understand why. If he could play a full tennis match without tiring, why run on a machine? He agreed, but during the test he felt chest pressure, and the ECG showed ambiguous changes. Even though these likely weren't serious, the cardiologist stopped the test and recommended a catheterization. This procedure, which involves threading a tube through an artery to the heart, is invasive and not without risk. Javier went from calmly preparing for minor surgery to lying on a gurney heading to a cardiac study. The results showed something very common for his age: minor blockages that required no treatment. But the emotional damage was already done. From that day, he stopped playing tennis, developed fear of exertion, and was labeled as heart patient, which was untrue. In rare cases, even the stress test itself can trigger arrhythmias or more serious issues. So how do we assess the heart in a sensitive, modern, and safe way? First, listen to your own body. The most reliable stress test is everyday life. If you can walk quickly or climb stairs without chest pain or disproportionate shortness of breath, you're already passing a real-life stress test. Of course, if symptoms appear, that's when you should consult a doctor. If we want to assess future risk, there is an excellent tool, the coronary calcium score. It's a quick test, low in radiation and needle-free. It measures the amount of calcium in the heart's arteries. A score of 0 means the risk of a heart attack is very low. A higher score tells us we need stricter prevention. This test guides decisions without pushing invasive procedures. Next, the fourth exam, colonoscopy. This one sparks debate. Colonoscopy is extremely valuable for preventing cancer, and I absolutely recommend it starting at 45 or 50. The problem arises when we continue scheduling it routinely for adults over 75 or 80 with prior normal results. At that age, we need to weigh benefits against risks. And risks increase with age. I'll share the case of Elena, 79. Her previous colonoscopy was normal. She had no symptoms. But the clinic's system reminded her it was time for another. She was responsible and prepared, but the prep alone was exhausting. Liters of laxative left her weak, dehydrated, and dizzy. At her age, that step alone carries significant risk. Add sedation, which in older adults can cause temporary confusion or breathing problems. The risk that worries doctors most is intestinal perforation. As we age, the colon wall becomes more fragile, and although the risk remains low, it increases significantly. And a perforation requires major surgery and a challenging recovery. Here, I want to bring you back to the core issue we're addressing today: how to avoid medical tests that may harm more than help after 50 or 70, and how to make wiser decisions to protect your health, independence, and peace of mind. A clear example is routine colonoscopy after a certain age. In an 80-year-old, a complication during the procedure could mean losing independence and quality of life. And when we analyze the real benefit, we see that the goal is to prevent a cancer that, if it appeared, would take years to cause problems. That's why serious medical guidelines recommend stopping routine screening between 75 and 85. The principle is simple: if life expectancy is less than 10 years, colonoscopy is more likely to cause harm than provide benefit. Of course, every case is different. Strong family history, previous polyps, or specific risks change the evaluation. But for most older adults, doing it automatically just because it's time ends up being more dangerous than helpful. So what should we do? It's not about abandoning colon care, but using smarter strategies. First, pay attention to key symptoms. This is vital. If persistent changes in bowel habits appear, blood in the stool, abdominal pain, unexplained weight loss, or new anemia, age doesn't matter. Colonoscopy is absolutely justified. Second, and possibly even more powerful long-term, is prevention through diet. The colon benefits more from fiber than any machine. Fruits, vegetables, legumes, whole grains. Fiber feeds good bacteria, which produce compounds that reduce inflammation and lower cancer risk. Eating more lentils, broccoli, oats, or apples is far safer and benefits the whole body. My message is always the same: get the right colonoscopies at the right time. Up to 75, they are generally essential. After that, for most, it's wiser to monitor symptoms and focus on dietary prevention. Now let's move on to the fifth and final test. This is especially relevant for older men, the PSA blood test for prostate cancer. For years it was hailed as a breakthrough, but over time we discovered that in older men it produces many diagnoses of cancers that would never cause harm. Diet, inflammation, infections, or even cycling can raise PSA levels. This leads to more tests, biopsies, and treatments that aren't always necessary. I recently treated a patient who experienced something very familiar. Ernesto, 79, lived alone, walked every day, and was full of energy. During a routine checkup, he was asked for a PSA for no clear reason. It came back slightly high, starting a long chain of appointments, doubts, and fear. The biopsy revealed an extremely slow-growing cancer, something that, given his age and tumor type, would never have affected his life. Yet the word cancer carries enormous weight, and he chose a treatment he is still recovering from. Cases like this are common and illustrate why PSA testing without careful judgment can have serious consequences for older men. So what's the right approach? It's not about discarding PSA, it's about using it wisely. Instead of automatic testing, we need clear conversations where doctor and patient weigh risks and benefits together. If a low-risk cancer is found, remember that active surveillance doesn't mean doing nothing. It means organized, careful follow-up to ensure the tumor doesn't become aggressive. Most importantly, we focus on symptoms that truly matter at any age: difficulty urinating, blood in the urine, bone pain, or persistent discomfort. These always require investigation, regardless of age. And with that, we reach the end of the journey through the 5 tests I would personally avoid after 50. Full-body scans that only create anxiety. Brain MRIs for minor forgetfulness that label without reason. Routine stress tests, which have more risks than benefits in older adults. Systematic colonoscopies after 75, where the balance tilts toward harm. And routine PSA tests, responsible for a wave of overdiagnosis. The lesson is clear: we need a more human, sensible, and personalized approach to medicine. Our goal isn't just to live longer, it's to live better, with independence, mobility, joy, and peace. True prevention isn't about accumulating tests in an attempt to foresee every problem. True prevention is walking hand in hand with your doctor, understanding the purpose of each test, and asking whether it's really necessary. It's maintaining a healthy lifestyle, moving your body, eating well, and listening to yourself. My goal is not to make you fear medicine, but to make you an active participant in your health decisions. Feel free to ask, "Doctor, in my situation, does this make sense?" Before I say goodbye, I ask something simple. If this message helped you or reminded you of a loved one, share it. Someone may need to hear it today. I also invite you to subscribe, turn on notifications, and leave a comment. We post new videos every day, and I'd love to know if you've ever felt pressured into a test you didn't feel was necessary. I read as many comments as I can and learn a lot from you. And as always, let's take a moment to thank God for life, for the opportunity to learn, and for the ability to care for our bodies with wisdom and calm. These reflections are also part of True Health. On this channel of Dr. Gabriel Mena, I feel deeply grateful to guide you and provide practical tools to improve your well-being. Tomorrow we'll have a new video created just for you, so I invite you to come back. Here, you will always find clear, human, and useful guidance to continue living with health, dignity, and joy.